Caregiver training. Hospitalization and billing compliance presented by Global Health and Home Care Services topic. Preventing payback issues, understanding billing risks and responsibilized. Insert training date audience, all caregivers and field employees. 1. Purpose of this training to help caregivers understand what activities are billable versus non-billable, why accurate documentation is critical, the risks of improper clock-ins, avoiding fraud and protecting your job. 2. Hospitalization rules. What you need to know. Do not clock in for hospitalized clients. When a client is admitted to a hospital, you are not authorized to provide services unless specifically directed. Nurses and hospital staff are responsible for the client's care during that time. If you visit the client in the hospital, that is personal and optional, not billable. Clocking in and billing for time spent at the hospital is fraudulent and puts the agency at risk of payback recoupment. Takeaway: never clock in unless the client is at home or at an approved location, and you are actively providing authorized care. 3. GPS out-of-range clock-in, clock-out. Do not clock in out from your own home. Repeated clock-ins from your own address or out-of-range areas raise red flags. The system tracks your GPS, and violations can result in audits and payback. Unless your home is officially registered as a family home and approved by a coordinator, do not clock in from there. Takeaway: always clock in from the client's home, not your residence or other locations. 4. Payback issues we are facing. Global Health and Home Care Services has already received demands to repay funds for unauthorized visits during hospitalization, repeated GPS out-of-range clock-ins, caregivers working without up-to-date screenings, TB screening, background checks, and annual training must be current. Lack of coordinator approval for exceptions. Takeaway: only perform work if you are cleared screenings, paperwork, background check. You have proper authorization and the client is at home. You clock in and out from the approved location. 5. Remember, caregiving must be authorized, documented at the client's location during valid home care hours based on actual work done, not just being present. 6. Best practices: always confirm hospitalization status with office staff. If unsure, call the office before clocking in. Keep up with all mandatory health screenings and background checks. Use GPS honestly. Don't clock in from home unless authorized. Maintain detailed visit notes if required. 7. Questions or concerns: contact your coordinator or office manager for clarifications on hospital cases, GPS location concerns, screening expiration dates, family home registration process.